That's taking a...
Yeah, it's recording. Look,
It is?
see?
Okay.
Now it's
Oh,
red.
now it is.
The neuro exam. Mental status. See www.neuroexam.com and watch Dr. Blumenfeld perform the mental status exam. Cranial nerve exam. Watch www.neuroexam.com except for cranial nerves 3, 4, 6, and 8 we will show you now. Oculomotor control. Testing cranial nerves 3, 4, and 6 as a system. Okay, so we're going to do smooth pursuit. You want your target for the patient at arm's length. So Cameron, please put your arms straight out in front of you. That is where my target will be. Okay. Cameron, keep your head still and follow my finger with your eyes only. We go side to side. And up and down. You can either do an H to assess the diagonals, or you can do an X. Okay, you're looking for the eyes to move smoothly through oil. Now, saccades. Again, at arm's length, our same spot, okay? You hold two objects, two targets. Cameron, look straight ahead. Now look at my finger to your left. To the right. Left, right. Note that the fingers are not more than 20 degrees to either side of Cameron's midline. Okay? Now convergence. Cameron, hold your thumb out straight in front of you. You are going to bring your thumb towards your nose until you see double. And tell me when you see double. Okay.
I don't know. Not seeing double.
Okay. If Cameron saw double here, we would measure the distance from the tip of his nose to where the object doubled. 6 centimeters from the tip of the nose is normal. We are also watching for symmetry of the eyes. Okay. Okay, we will test cranial nerve 8 as part of the cranial nerve exam, the vestibulocochlear nerve. We are just going to test hearing right now. Okay, Cameron, I'm going to brush my fingers on either side of your ear, and I want you to tell me which ear you hear. Close your eyes, please.
Left. Right. Both.
Very good. Open. Okay. Now, I'm going to hold this to your ear, and I want you to tell me which is louder.
The first one. First one.
Good. All right. Now I want you to tell me which side you feel this most on. Hear this most on.
Both.
Thank you. For the motor exam portion of the neuro exam, you can use any of your musculoskeletal techniques that you've learned, such as myotomes, manual muscle testing, or brake tests. Now we will test deep tendon reflexes. Oh, okay. Thank you, sir. Okay, we're going to test the biceps reflex. First, you want to locate the biceps tendon and place your thumb on that tendon. Then you hit your thumb with the hammer and palpate for a response under your thumb. Okay, other side. Now we'll test the Brachioradialis Tendon. Find the tendon mid-forearm. Same technique. Watch for the hand to move as well. Movement of the hand. Okay. Now we will test the Patellar tendon reflex. You go to the base of the patellar tendon. You should have learned this already. There we go. Good. Now, for the Achilles tendon reflex, you place the foot in slight dorsiflexion and you strike the long end of the reflex hammer right on the Achilles tendon. Feel for plantar flexion and watch for plantar flexion. Moving on to coordination. Now moving on to the coordination and gait exam, we are only going to focus on coordination right now. We will look at gait later. Okay, Cameron, I'd like you to touch your finger with one note, touch your nose with one finger. Now, my finger is a little shorter than arm's length away. Touch my finger with your finger.
This finger?
Yes, touch my finger. Now touch your nose. Now touch my finger and your nose. Back and forth. A little faster. Okay. Now your left hand. Touch your nose and touch my finger. Finger, nose. Finger, nose. Okay. Note, there is an alternative method to testing finger to nose. Cameron, put your other arm out. Now switch. Touch your finger with your right hand. Switch. Switch. And switch. Good. Okay. Now, pronation supination. Place your hands flat on your lap. Palms up. Palms down. Palms up. Palms down. Now as fast as you can. Very good. You're looking for symmetry. Now heel to shin. Cameron, if you would take your right heel to your left shin and go up to your knee and down to your ankle. Up and down. Okay? Left heel to your left shin, go up and down. Thank you. Okay. Sensory exam. We will be doing sharp, dull, temperature and pain because they are on the same pathway, vibration, proprioception, and kinesthesia. Again, you can watch www.neuroexam.com for graphesthesia, stereognosis, and extinction. We will now be doing pain and temperature. I will do that first. Note that we can test pain and it also assesses temperature because they are on the same pathway. All right, Cameron, close your eyes, please. I would like you to tell me if this feels the same or different.
Same. Same. Same.
And you can do that throughout the digits and on the lower extremities. Open your eyes. Okay, Cameron, I want you to tell me if you feel sharp. Oh, please note, Dr. Blumenfeld in his video does the pain stimulus and says, how about now? How about now? Avoid directing the patient to when you are going to give them the stimulus because if you tell them, they're ready for it and may give you a false positive. Now we'll test sharp, dull. Cameron, turn your hand up, please. I want you to tell me if you feel sharp or dull. Close your eyes.
Sharp. Sharp. Dull. Sharp. Dull.
Okay. Now we will be testing vibration. Also note that Dr. Blumenfeld tests vibration on the fleshy part of the great toe. When we are doing this exam, typically we are testing on the bony parts of the foot. Cameron, please close your eyes and tell me if the tuning fork is vibrating or not vibrating.
Vibrating. Not vibrating. 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 Not vibrating.
And then we're going to move to the malleoli.
Not vibrating. Vibrating. Not vibrating. Vibrating.
Very good. Okay. Proprioception and kinesthesia. We are very particular about these. We will be testing up and down motions, flexion and extension of the great toe. You can also do of the ankle. We're only moving the toe up and down, and you must have your fingers on the outsides of the toe or the outsides of the foot. If they feel your fingers on the top and bottom, they will be able to pick up other sensory feedback and identify up or down without using proprioception. So, Cameron, close your eyes. I want you to tell me if your toe is up or down.
Up. Down. Up. Down. Down. Up. Down.
Okay. Now, kinesthesia, proprioception is position sense. Kinesthesia is movement sense. So this time, Cameron, while your toe is moving, I want you to tell me if it's moving up or down.
Up. Down. Down.